The next few months will be vital when it comes to illnesses. As flu season begins and mixes in with COVID-19, it will become even more difficult to tell what's wrong with you. So Buckeye Health is on a mission. Here's more on their award-winning Fluvention program.
And joining me now, we have the Chief Medical Officer for Buckeye Health Plan, Dr. Brad Lucas. Doctor, thanks for being with us today.
Hello, thank you. Thanks for having me.
All right, let's get an overview. What can we expect this year? It's different than obviously any other year, given that we've got the flu season coming. We've also got the ongoing COVID-19 pandemic. So what are you seeing for the season ahead?
Yeah, already I'm seeing confusion. The flu seems to be out in full force already. Hearing enough people having the symptoms, feeling miserable, achy, chills, fever, sore throat, getting the COVID test, that waiting on that being negative, and then thinking, well, gee, I must have had the flu. We're dealing with both now. So in my mind, we really this year want everybody to get the flu vaccine to eliminate that confusion. If you come out with all these symptoms and you know you've had the flu vaccine, then I think it makes it easier for our healthcare providers to diagnose and figure out what's going on.
All right. So Buckeye Health Plan, you guys have this kind of Fluvention program trying to help people note the differences, right? Trying to help them tell the two apart, which we know can be difficult. So let's talk about some of kind of the differences in symptoms between COVID-19 and the flu.
Yeah, we think more of the COVID-19 is when those people are not hospitalized, is the symptoms coming on quick and having that miserable day about the high fever, and the influenza seems to last a little bit longer symptomatically. But I concentrate more on the similarities. It's just we really don't want people out there trying to decide on their own which they have. If you're short of breath, having a persistent high fever, unusual symptoms, get in touch with somebody who can help give you direction and get testing.
Now, as far as how the viruses are spread, we know that COVID-19 is very contagious. We know the flu is contagious, but so when you're out there, what can people do? What are we looking at as far as being cautious out in the world?
Yeah, respiratory droplets or droplets that can get on the surface that you touch and touch your mouth. No different than what we've said for years, which is don't touch your hands to your face. Wash your hands. If you're sick, stay home. Certainly the masks and the distancing. These are all things that would have been effective in the past, whether you have a common cold or influenza. Certainly from what we're familiar with this with COVID. Now it's really the time to double down and stick with that until we're kind of past it all.
Right, all the things we need to do. We need to keep washing our hands. We've got the masks. We've got the social distancing. So let's talk a little bit timeline. We know that the flu vaccine is available now. When is the best time to get it?
Oh, now. Get it as soon as you can. And even if for some crazy reason you've not been able to get it and you get into the next year, still get it. The flu season goes for a long time, but it's available now. It's very accessible. You'll find it and get it.
Okay. And then Buckeye Health Plan, like you guys said, you have all these ways that you're reaching out, reminding people, sending them text messages. I mean, I think I have seen a number of emails, get the flu vaccine here. It's no cost under most people's health plans. I mean, there's really no reason to avoid it, to wait too long to get it. And I've also heard getting it like a couple weeks before maybe Halloween. These things that you're going to be, if you're going out, right? I mean, that's important.
That's an important thought. Yeah. We incentivize our members with $25 when they go out and get a influenza vaccine. And yeah, lots of messaging, letting them know where they can get it, where they can find it, who's doing it. Almost all the time it's at no cost. Not unusual for employers to offer it to their employees.
Okay, all good stuff. Really, the bottom line is get the flu vaccine. It's only going to help, obviously, in this crazy kind of time we're dealing with. So, Dr. Lucas, lots of information from Buckeye Health Plan. Thanks for being with us today.
Thank you.